Good morning, everyone. Welcome. A happy Monday to all of you. Thank you for joining us for another episode of House Calls, Real Docs, Real Talk. I'm Chelsea Helms coming to you live from the KNWA News Studio here in Fayetteville, Arkansas. And while I am in Northwest Arkansas, I'm excited to be joined by so many of you from all over the nation and really the world this morning. A really great way to start our week together. All right, today we are discussing the lasting effects of COVID-19. As you know, every day our medical professionals, they are learning more and more about this virus. And we want to share the latest updates with you, as well as address any of those ongoing questions that many of us have, because quite frankly, this is something that we are all dealing with and have been for quite some time now. Throughout our show today, if you do have a question you'd like us to address, you can visit us at heart.org/housecalls and submit your question. And you can drop it also down in the comments throughout the show on any of our live feeds. And we're going to do our best to grab those questions and answer as many as we can right here. You already know this, but a big part of the show is the involvement from all of you. And so today we do have two things we want to ask you to help us with. First and foremost, throughout our show, we're going to break for a few questions. And of course, we want you to answer and respond as best as you can. All you have to do is use our easy text to answer feature. It is texting AHA Live to 22333. You can see the information right there for you on your screen. Now, the nice thing is we're not going to ask you for your name or really any other information. This is simply just a way for you to join in with us. And we love when you do that. After that, we also want to ask that you hit the share button or just start a watch party, whatever you find is easiest for you, so you can share the stream with your friends and families. Like I said, we already have an incredible audience. I have noticed people from every part of the country really joining us and really around the world. So super excited to have you here with us on this Monday. So we're going to go ahead and get started. With me this morning is Dr. Heather M. Johnson, preventative cardiologist with Christine E. Lynn Women's Health and Wellness Institute at the Boca Raton Regional Hospital and Baptist Health South Florida. Dr. Johnson, welcome.
Thank you so much, Chelsea. I really appreciate the opportunity.
Well, we are so excited to have you here with us all today. Before we do begin with our discussion, we're going to start in with our first viewer response question. Which of these statements best describes your quarantine behavior? You can go ahead and take a look at the different options on your screen. I have a feeling we're going to have quite a difference in opinions with this one today. Dr. Johnson, which would you say is your quarantine behavior?
Definitely observing precautions and wearing masks. I have to say that we moved to the area here in Boca in January, so we've been practicing learning restaurants by takeout and enjoying, in fact, going really restaurants and malls and things like that, as safely as possible.
Yeah, I'm with you on that. I'm one of those people, practice what you preach, right? So every single night we're having health experts on our shows here in Northwest Arkansas who are just talking about the importance of wearing that mask when you are out and about. So I'm always wearing that mask when I'm out and about, which I'm an essential worker, as are you. So I know that we have to continue going out into the community. So I wouldn't be surprised if some people are saying, hey, I'm completely quarantined, especially if you don't have to get out of the house, right?
That's right. You're exactly right. And it's all about being safe, and especially depending on other people that are living with you, your health conditions or other things. Do what's best as far as keeping yourself and others safe. When and if you do go out, yes, wear face coverings. That's our biggest thing, is show that we care about others, for sure.
Well, and it looks like our viewers are feeling the exact same way, because at least every person who's answered so far is taking some sort of precaution. So we're excited to see that. With that said, we're going to get started with our very first segment, Health in the Headlines. Each week, we select one current headline that ties back to the topic we are discussing during the show. And what we're going to do is ask you and our expert to respond. So this week's entry is from Science Magazine, and it's titled Brain Fog Heart Damage. It reads, COVID-19's lingering problems alarm scientists. So Dr. Johnson, talk to us about what this article is really saying, and can you help us understand these new developments?
Yes, this article did a great job highlighting three important points. And first of all, people who have been infected by COVID-19, we are learning more and more every day. And unfortunately, there are these lingering effects as far as symptoms that continue to occur weeks after being initially infected by COVID-19. And this article also highlighted the fact that the symptoms can wax and wane. One day you may feel better, one week you may feel better, but then unfortunately you may feel ill. And it could be new symptoms or worse symptoms. And we're realizing that the symptoms can be throughout the body: fatigue, forgetfulness, short-term memory loss, the brain fog or brain fogginess, chest discomfort, skin changes, skin tingling, muscle pain, intermittent elevations in temperature, even if it may not be a full fever. So I like the fact that this article highlighted and let people know that they are not alone with these symptoms. And in fact, we're learning more and more about support groups and also research initiatives, and healthcare providers like ours are here in Boca, where we're actually following patients who've had lingering symptoms. And so this article really wants people to know that it is a real fact. It does indeed happen. And there are people that are really monitoring this, and to also try and reach out to some virtual support groups just to be able to share the symptoms. And we'll talk a little bit more about how these symptoms are followed and things that are being done as the show progresses.
Looking forward to that, especially because I know that these symptoms have kind of been developing throughout the length of the time that the sickness has been around. When it first came out, there were X, Y, Z for symptoms. Now there's A through C at this point. We're trying to learn more about what exactly COVID-19 is causing and those lingering side effects you were talking about. So looking forward to diving deep into that. And with that said, we're going to move on to our next segment. That is You Ask, We Answer. And You Ask, We Answer, we're focusing on your burning questions every single week. As you know, we ask you to submit questions and we answer them right here live. You can watch some of our past episodes where we've had some incredible conversations with some great experts. You can do that by visiting the House Calls website at heart.org/housecalls. Like I said, you can find all of those previous episodes in one place. As you know, we've been talking about it throughout the show. This week, our topic is long-term effects on COVID-19 on your health, one that is just really resonating with people all across the country. So happy to hear you being here with us. Now, our first question, Doctor, that comes to us from Lyle in Burbank. Lyle wants to know, are researchers as focused on the long-term effects of COVID as they are on finding a vaccine?
Most definitely. First of all, that's an outstanding question. And I can say that researchers and healthcare providers are very interested in long-term continuing symptoms in addition to finding a vaccine. In fact, there is an effort going on both nationally and internationally called the COVID-19 Symptom Study. If you Google it, you'll be taken as far as to where they're asking people to please share their symptoms to be able to track it. There are formal research studies with the goal of being able to track people for at least 1 year and then beyond. What we're realizing is that here in the US, we're still approaching that 6-month mark as far as the COVID-19 infection. And so we are learning about the lingering effects and lingering symptoms week by week, day by day. And yes, it definitely is on the forefront of researchers and healthcare systems as far as realizing that we have to continue to care for patients and understand these lingering effects in addition to the ongoing work for a vaccine.
Yeah, that's a really important point you just made. It's one of those things where the research just never stops, whether you're looking forward or you're looking at what's happening right now. All right, Stacy from Virginia, she asks, when is antibody testing done and why do you think it's so important?
Another great question. So thank you for the question. So after we have the initial COVID-19 infection, our body tends to develop antibodies starting about 1 to 3 weeks after the initial infection. And the antibody testing is serving multiple purposes right now. If you've had a prior COVID-19 infection, if you've developed antibodies, you may be eligible to donate your plasma as far as helping other patients recover who are currently hospitalized and very ill from COVID-19. And so there is a national push, a national request as far as asking people to consider at least determining if they're eligible and donating plasma if possible. The other thing is that we're noticing, to go back to the symptoms of COVID-19, is that some people may have symptoms, but because they're developing or progressing later as far as symptoms, their actual COVID virus test may be negative. The actual infection may have happened some time ago. And so sometimes patients have been tested for antibodies, even if their COVID virus test is negative, and we're realizing that they had a prior infection, just past that active infection time. And so some of the symptoms that we're seeing in the community do represent prior active COVID infection. And so it's another way that we're beginning to track the symptoms and effects, and the antibody test can be very important for that.
All right, so Dr. Johnson, you actually covered a bit of this next question in your previous response, but we're still going to ask you because I think that there are a couple parts to this question that you might want to break down a little further. So Monique in Indiana, she asks, if I've recovered from COVID, should I donate my plasma to help the treatment for others? Which, like I said, you kind of touched on that. And then to expand on it, is it okay to donate blood in the future?
Outstanding question. And so the American Red Cross has actually started testing everyone as far as who's presenting to donate blood or plasma some months ago to look for COVID-19 antibodies. So the answer is yes to both of those questions. Please see if you indeed are eligible to donate plasma related to helping other people recover from COVID-19. We are still learning about the process as far as other donations of blood products. And so for anyone that comes to try and donate blood to the American Red Cross, they are testing to see if you have COVID-19 antibodies. If you do, they'll then have the discussion about possible plasma donation. Otherwise, they'll look as far as your eligibility regarding blood donation and other products. And so we're asking everyone, yes, blood products are indeed needed across the board. And so even without a prior COVID infection or with a prior COVID infection, hopefully somehow some blood product may be available as far as you being able to donate as far as your eligibility. So thank you for still being interested in it. And yes, the American Red Cross is walking people through those steps.
Well, and when you speak about eligibility, I think that you're meaning more so you have to be a certain weight to donate plasma. Your body has to have certain proteins, correct?
So yes, there are different things as far as ongoing or current other medical conditions, as far as the length of time, the antibodies, whether or not there's still signs as far as other infection. So there are quite a few steps that are protocols that are in place for it. I can tell you it's called convalescent plasma therapy. And ever since the FDA approved as far as this particular investigational treatment, it has definitely been part of many hospitals around the country as far as helping patients recover. And so even local hospitals or the American Red Cross can definitely guide you as far as determining as far as with your own current conditions and or your prior COVID-19 infection, and where you are out from that as far as your eligibility to donate. So yes, there are some questions that have to be addressed, and it really varies individual by individual.
Well, thank you so much for breaking that down. We appreciate it. I'm sure a lot of people have questions about that plasma donation. Now, we have a lot more to cover, many more questions for Dr. Johnson, but first we're going to take a quick break for another poll question. So of course we can hear from all of you at home. So grab that cell phone and get ready to text in your answer. As a reminder, all you have to do is text AHA Live to 22333. If you've already registered, good for you. You don't have to do it again. Just get ready and text your answer once again to 22333. So this one is more of a vocabulary test, I'll say. Our question is, what does the term long hauler mean? Full disclosure, I am not sure, so I'm looking forward to seeing what the answers do end up being. Before we get to the answers and spoil it for them, Dr. Johnson, by giving them the answer, I want to give a shout out to some of those awesome people who are watching us live right now. So on LinkedIn, we have Shara from Alaska, Hoda from Iran, and Obed from Houston. Thank you guys for joining us on our LinkedIn page. And on Facebook Live, we have Kim from Alabama and Cindy from Mexico. So really excited to have so many people joining us from all over the world today. So exciting. All right, let's take a look at those options. So a long hauler, truck driver, deep sea fisherman, COVID-19 patients with lingering symptoms, and suburban mom with carload of children. I'm going to guess that it's probably C based on our topic, but care to elaborate?
Well, congratulations. Yes, the answer is indeed C. And I know that, no, I'm happy to discuss long hauler a lot further. We also know that that can fall under truck drivers. So who answered that, you are also correct. But for this particular conversation, I'm going to focus on the COVID-19 symptoms.
I love it. I love how there were multiple answers that were right. We love to have as many people right as we can, right?
That's correct.
All right. Thank you so much to everyone who took the time to answer on that. We're excited to have so many people taking part in these different questions. All right. So our next one, have you been trained in hands-only CPR? Now, as I'm sure you know, doctor, this is an important question because we all know that right now, many of us, we are spending a lot more time at home with our family and are maybe not as active in the community, unfortunately, as we might have been before. And should you need it, knowing CPR could really save a loved one's life. So we're going to show you this quick video, and then we're going to come back and see how many of you actually know what to do. So take a look.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
A great, insightful video there. As you can see, we have people pretty much split on have you ever been trained in this, and just based on that video, I'm guessing everyone should have some sort of training like this. Would you agree?
I completely agree. In fact, yesterday I just renewed my CPR, basic and advanced cardiac life support through AHA. So yes, 100% everyone should be trained as far as in hands-only CPR is outstanding skill to have in the community. So I'm glad this was raised.
Well, I'm happy to see that some people have that experience, and hopefully maybe those of you who answered no, you're going to take that step and further educate yourself on ways you can do that. All right, let's go ahead and get back to our topic at hand and address a few more of your questions. Dr. Johnson, this one's coming from Lisa in Milwaukee. She asks, I'm a long hauler. There's that question we had earlier, and have experienced trouble and concentrating and even some short-term memory loss. Do doctors know how long COVID side effects can last?
Yes, the term long hauler, just to go back to the original question, has to do with COVID-19 symptoms lasting for at least 1 month. And currently the definition says out to 3 months. And I say currently the definition means at least 1 month and out to 3 months is because we do not yet know the full answer as to how long COVID-19 symptoms last. As I mentioned before, there is a national and international study really highlighting as far as tracking and following patients with COVID-19 symptoms. We are just approaching the 6-month mark. Unfortunately, there are quite a few people within our community who have had ongoing symptoms. Yes, unfortunately, we also know that the symptoms can be very broad. We are realizing that the COVID-19 virus affects a lot of different organs in the body. And being what's called now a long hauler or having prolonged symptoms, even if you had a very mild case of the infection, we're realizing that symptoms can either develop down the road or continue down the road. So it does not have to do with being previously hospitalized or presenting with severe symptoms. We do not yet know how long the symptoms will last. We are continuing to follow this day by day, week by week. From a healthcare perspective, I can say that our job is really to support patients, let them know that the symptoms are real. We are monitoring heart, kidney, liver, multiple organs, even through the clinic, and just making sure that patients have the support they need as far as managing and working through these symptoms. I also want to acknowledge not just physical symptoms, but the mental and emotional toll that these symptoms are having on patients is also real. So just know that it's definitely on our hearts as far as researchers and the medical community.
Well, and I think you made a really important point. Even though we've been here for 6 months, and to all of us who maybe have been stuck at home for quite some time, it feels like a really long time. For those who are studying it, it's not. This is just the beginning of what's going to be a long, extensive research project.
Yes,
all right.
Definitely.
Trini from Brooklyn, she says, I just read that 5 college athletes were diagnosed with myocarditis linked to COVID. What is myocarditis, and how concerned should I be about developing this after my COVID recovery?
Another great question. So myocarditis is an inflammation of the heart muscle. So myo meaning as far as myocard, as far as the heart muscle, itis meaning inflammation. And yes, it is one of the signs and symptoms we're seeing related to COVID-19. The inflammation of the heart muscle can result in chest discomfort, palpitations, abnormal heart rhythms. In rare cases, also unfortunately, sudden cardiac death. The interesting thing about myocarditis is that it's not just seen with COVID. We also see it with certain forms of influenza and other viral infections. And even certain medications can cause myocarditis. And so in the healthcare field, we've definitely, as far as been monitoring patients who are developing this. Now, myocarditis is on the spectrum of heart-related complications from COVID-19. Some people may have chest discomfort, shortness of breath, palpitations, skipped or fast heartbeats, but may not have myocarditis. So I don't want you to think that having those symptoms mean myocarditis. One of the key things that we are focused on, though, is that understanding that there is a recovery process. We're particularly seeing it in the news as far as with athletes because of the level of strenuous physical activity associated with it. And so even in the community, I am explaining as far as to patients that it will take time for the body to heal from this and to avoid strenuous physical activity until these symptoms really resolve, because as we talked about, we know they can definitely wax and wane. And so the fraction of people presenting with myocarditis as far as the severe cases, although it's small, it is definitely a serious side effect. And again, it's one of those things we're monitoring closely.
A good reminder to see your doctor and not assume that if maybe you have one symptom, you got to go on WebMD and do all this research because you're going to have this next other thing, right?
You are exactly right. And that's the key thing, is really being in touch with the medical professionals.
Definitely. All right. Our final question is from Val in Sioux City. She asks, are physicians seeing any different lasting effects on maybe children and teens who have had COVID-19 versus some of our adults?
Also, great question. So far, and again, we're still learning week to week, day by day, children and teens, as far as lasting or lingering physical effects, it does not seem to be as severe as an adult, but we are still learning. We also have to understand too, is that again, because it is so early, we're monitoring it very closely. We have not quite fallen into the long hauler definition as far as in children and teens. But again, we have to be very careful as far as ongoing close observation. Also, what we're realizing is that even if it's not physical symptoms that we may, put a formal diagnosis on as far as chest discomfort or pain, we have to also consider the mental and emotional toll as far as what COVID-19 is having on our children and teenagers. And so that's something else we're also watching in the medical community.
Glad to hear it, because I know a lot of families have been wondering this exact same thing. So we appreciate you answering all of these questions very thoughtfully. We're going to keep you around as we do move on to our next segment. That is, what would you say?
Great.
And what would you say? We want to hear from all of you at home. If you've been with us throughout today's show, you already know what to do. Grab that phone and get ready to text your answer to 22333. We want to know how you're feeling. Has a fear of the coronavirus increased your stress and anxiety? That's a great question, and one that I have a feeling we're going to be seeing a lot of yeses for. Doctor, have you heard from any patients or anyone specifically, maybe family members who have reached out to you telling you that they're feeling this type of stress or anxiety?
I have told patients every day that this is a very, very common symptom, that they are not alone. In fact, we did a webinar a couple months ago talking about the stress related to COVID-19 on the mind, on the heart. And this is definitely another real effect related to COVID-19. Some people notice fatigue, stress. It is an emotional toll. And as we talked about, from children through adults, we are all learning, even in the communities, about this virus every single week. And so we ask each other, please support each other virtually, reach out, still maintain social distance, but just even sometimes instead of a text, pick up and allow people to hear your voice on the phone, because as far as being able to stay in contact with people and provide support, that's a really, really key factor to get through this.
I heard on the radio just the other day when I was driving around that some people are actually saying they're reaching out to those people even more so who maybe they've been disconnected from for a few years now because of the pandemic. So I guess if there is some silver lining, maybe there are some reconnections happening.
You are correct. There are a lot of reconnections happening, and we're learning how to really strengthen our social circles and reach out to people. I've encouraged people in the community and patients to find groups. I know that there are knitting groups and reading groups and book clubs and exercise groups around, as far as being able to support each other. We're all learning that this is going to be a process, and being able to support ourselves and each other is going to be a big part of it.
Absolutely. Now, we also want to hear from you at home. Are you currently caring for a loved one with COVID-19? Or maybe if you aren't right now, but have at some point throughout this pandemic. So go ahead and let us know. I know that this hasn't been something that I've personally had to deal with. Have you heard anything about, friends, family members, colleagues, Dr. Johnson?
Well, as a healthcare worker, I see it on two different views. Yes, as far as those frontline workers, but then unfortunately, yes, people in the community that have cared for others who have had COVID-19. And it's important to understand that not only is it caring for them, but keeping yourself also safe and those in the community safe. And it's one of those things that we're learning how this presents, and again, about the lingering symptoms and being able to support people even after the active infection has cleared, but there may be some ongoing symptoms. If you are caring for someone, again, finding time to care for yourself in order to stay strong and refresh yourself mentally will be a key factor.
I think that's a great reminder. And just looking at the poll results here, it's looking like a lot of our viewers, they haven't had to take care of someone with COVID-19. But what is nice to know is that in the event you have to, there are those people who have, and they can hopefully share their experience with all of you who might have that experience in the future.
That's correct.
All right, Dr. Johnson, thank you so much for keeping us all up to date. Obviously, throughout this pandemic, there have been so many changes for everyone, so much new information, and so much I think we all still don't have the answers to. So it's going to certainly take more conversations like this one to continue to address the evolving news and science as it happens. I'd love to offer you the floor to give us any final thoughts before we bid you a good day today.
First of all, thank you so much for this opportunity. I've really enjoyed it, and my hat's off to AHA, the American Heart Association, for keeping people informed as the news literally changes day by day, week by week. And in closing, continue to remain safe, wear masks, staying 6 feet apart, and continue to look out and support each other. Thank you. Have a great day.
Thank you. It's been such a pleasure having you on here. I hope you have a great week as well. All right, of course, before we sign off, we have one more thing to share with you, and that is our weekly health hack. Health Hacks is brought to you by Stories of the Relentless, the American Heart Association's podcast. You can go to heart.org, iTunes, Spotify, or Google Play to find it. You'll find many amazing stories and conversations on a variety of topics. So I encourage you, go check it out, subscribe, share your thoughts in the reviews, and share it with your friends and family. So this week's health hack comes from Carlo. Hello, Carlo. Carlo has upped his exercise routine, whether he's outdoors or indoors, with these two simple exercises. So first, he walks heel to toe for 20 steps to improve balance. He also does some planks or squats to break up a TV binge between episodes. So great tips. Thank you, Carlo. Loving the planking and binging idea. Great idea, especially because I think a lot of us are maybe binge watching some of those shows on Netflix or just other mediums. So we appreciate the helpful tips and hints and great ideas. Now, remember, we feature a new tip each and every week. So if you do have a great idea, be sure you send it to us at heart.org/housecalls. And maybe you're going to see your idea live right here on the show. I want to give a quick shout out to some more of our amazing viewers who are joining us live. We have Bushra from Pakistan joining us on Facebook Live. Also, Dedi from Illinois and Elsa from Saudi Arabia. Thank you all so much for hanging out with us this morning and commenting throughout the show. And then from LinkedIn, we have Megan from San Diego, Janelle from Princeton, and Frank from Tampa. So just really incredible to see people from different parts of the country and the world. Now, don't forget, I know that we ask a ton of questions throughout this show, but each week there are always many more questions than we have time to answer. I mean, in fact, I've seen several of you commenting questions throughout the show, which is exactly what we want. So if we did not get to your question here live, don't worry, we're going to work to get to as many as we can on the House Calls after show. You can look for it Wednesday featuring Dr. Johnson on our social channels and on the AHA's podcast. As I mentioned earlier in the show, you can find any of our previous episodes at heart.org/housecalls. That is all for today. Thank you so much for your time and for joining us today. We hope you'll join us again next Monday, and I know you will because you guys have been so great to us. Once again, I'm Chelsea Helms coming to you live from the KNWA News Studio in Northwest Arkansas. Thanks again for watching. I hope you will all have a great week. We'll see you next time.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org.